Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by FixED, www.fixed.net.au.
Today we did two penile implant prostheses. One was using an infrapubic approach and the other one was using a penoscrotal approach. And I'll pass you on also now to the eminent expert in this area, Dr. Chris Love from Melbourne.
Thanks, Otto. It went well, I thought. The cases went really nicely, and it was good to do the difference between the two approaches and see how they went. And no, I was very pleased with how they went. I wanted to just sort of see what you thought about the antibiotics we use, and particularly the ability to soak the implant in antibiotics. I think you use the same antibiotic solution I do.
I do, yeah. I mean, I actually like the idea to be able to use the antibiotics of your choice. And as you know, I mean, I also use the same antibiotics, which is vancomycin and gentamicin, and I think it works very well. Yeah. I mean, you know, in my experience, we've had very limited problems with infections.
Yeah. I think that the beauty of the Titan implant is that you've got the hydrophilic coating, which in itself helps with infection because it makes it more difficult for the bacteria to attach to the implant, and then being able to tailor, particularly if you've got a problem in your institution where there's a certain resistance amongst bugs, you can then tailor your antibiotics. So
absolutely.
Certainly I think it works well. I agree with you, the infection rate in mine is very, very low as well, so certainly it works nicely in my hands.
Yeah, I think it's a good approach, and I think, like you said, you know, like we've had recently a lot of patients when we had, for example, other procedures like trus biopsies. When if people that have travelled overseas, they have a certain bacteria which is it's resistant to your normal antibiotics, and then if you know that the patient have had, for example, history where they've been overseas, then you can tailor that antibiotics to that.
No, it works well. Oh, well, it was good. Thank you for having me up here today. It was good to do some cases with you. So.
It was great actually to have an expert in the field like yourself and learn from the master.
Excellent. Thank you.
Thank you very much, Chris.
Good on you.
Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by FixED, www.fixed.net.au.